Nagamia Institute of Islamic Medicine and Sciences, formerly known as the International Institute of Islamic Medicine, aims to bring alive discoveries and inventions in medicine and other sciences. Through exhibitions, storytelling, and modern technology. We are a network of academics, historians, scientists, and physicians with deep subject matter expertise. We are eager to share our knowledge to create experiences that produce a better understanding of the Islamic ethos and the contributions of Muslims to medicine and other sciences. We invite you to join us to promote a scientific mindset and to inspire excellence in generations to come.
Assalamu alaikum, everyone. My name is Mariam Husain. I want to welcome you all to the NIMS event, the Introduction to History of Islam and Medicine. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Alhamdulillahi rabbil alameen. Ar-Rahmanir Rahim. Maliki yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Ameen. Again, everyone, Assalamu alaikum. Thank you for attending our NIMS webinar this morning or this evening, wherever you are at in the world right now. Again, my name is Mariam Husain. I work with NIMS, the Nagamia Institute of Islamic Medicine and Sciences. We're very excited to have this webinar today, which is being hosted by our chairman, Dr. Husain Nagamia. For those of you who may not be familiar, Dr. Nagamia, he actually started the International Institute of Islamic Medicine, or IIIM, before, and now it's become NIMS. He is the Chief Emeritus in the Department of CardioVascular and Thoracic Surgery and Transplant Surgery in Tampa, Florida. And he is also Vice President of the International Society of History of Islamic Medicine. So it's my great pleasure to introduce Dr. Nagamia in this presentation.
Generous introduction. I'm Husain Nagamia, Chairman of the International Institute of Islamic Medicine. Today, we are gathered here today to talk about history of Islamic medicine. History of Islamic medicine is a very wide subject, so we are going to give you just an introduction, a small, brief kind of introduction so that you can understand what is Islamic medicine. But before I start that, let me tell you about what is NIMS. NIMS stands for the Nagamia Institute of Islamic Medicine. It was formerly called the International Institute of Islamic Medicine. It was created by IMANA in 1992, and the main purpose of creating it was to do research or stimulate research into the history of Islamic medicine. You know, history of Islamic medicine is was a very neglected subject. Very little has been known about it. Very little was written about it. The few books that were published before were by Oriental authors, Western authors actually, that published their findings, and it was viewed with their eyes. Very few Muslims have written about the history of Islamic medicine, except in the early 13th century, a very famous physician by the name of Husain. He wrote the entire history up to his time. And he described all the physicians, etc. We'll talk about it some other time. Let's now go to the These are my credentials, which probably Mariam already gave it to you, so I will not dwell on that. Let's go and examine the periods of history of medicine. So the periods of history of medicine are divided into the ancient or Greek Roman period, which is extended from 2000 BC to about 700 of Christian era. Then we come to the medieval times, which are also called the Islamic times, and that starts at 700 Christian era and goes up to 1500 of Christian era. Then comes in the European or modern period, when the European Renaissance took place, and the Europeans started interested in development of sciences, including medicine, and the knowledge came from the Islamic lands, and a lot of the Arabic books were translated into Latin, and then they were used by the Europeans to develop further into the sciences of medicine, mathematics, astronomy, geography, and other allied sciences. And then, of course, in modern times, the American system of medicine has taken place and replaced the whole system of medicine almost around the world. And that starts at about 1900 and goes on further. So mainly we are going to devote ourselves to the medieval or the Islamic period, which started in about 700. But before I come to the Islamic period, let's talk about what happened just before the Islamic period began. So what happened before was the time that the Greeks were, for the first, trying to introduce rational medicine. You must understand that ancient medicine was medicine which was kind of a voodoo medicine, where people believed in the fact that sickness arose as a result of the body being possessed by evil spirits or the devil. And therefore, if a person felt ill in the ancient times, they would not go to a clinic or a doctor, they would go to the priest. And the priest would then pray and do some incantation, do some charm, do some sacrifices in order to get rid of the evil spirits in the body, so that the patient could get rid of the disease that he was having. Early in the Greek, about 300 BC, when Hippocrates was born, he, for the first time, promulgated the idea that disease was not as a result of evil spirits, but was as a result of derangement in the body. And he put forward the idea that the body should be corrected and the derangement should be corrected in order to get the evil spirits. Now, who were the main contributors of the Greek period? Asclepius is ascribed early, somewhere about 700 or 800 BC. Then we have got Hippocrates. Hippocrates was called Bukhrat by the Arabs. And then there was the school of Hippocrates, which was developed in the island of Kos in Greece. And there were several islands where the Greek philosophers like Aristotle, Socrates, also indulged into giving some medical cures, etc. One of the most important was Dioscorides, who was a Greek soldier who went to all the wars, and he got developed interest in the herbs, herbal plants, and he started documenting the benefits of each of these plants in a very big compendium, which is called the Dioscorides Compendium of Herbs. And this became very famous because all the herbal doctors of the time started using this as a reference book. And then this was translated into Arabic later on. one of the most important physicians that developed in the Greek times was Galen, who was known by his Arabic name of Jalinus. So here are some pictures. Here's a picture of Asclepius with his medical staff. As you know, that the symbol of the physician in modern times is a snake winding around a staff. This is known as the caduceus. And here's a representation of the caduceus being held by Asclepius, who was actually a mortal human being, but was raised to the status of a deity or a god by the Greeks, because they used to worship. So Asclepia, or temples celebrating the Greek god of healing, or Asclepius, were all around the Greek islands, and the sick used to go to these temples, and the priests would then try and cure them. So here's a picture of Hippocrates. He lived around 460 BC to 375 BC. He formulated what is known as the Hippocratic corpus, and his students, which he taught in the island of Kos in Greece, then started writing down his sayings and his what is called the aphorisms. The dictates of things that he said were written down in the aphorisms, and they gave some guidelines of how the physicians should be treating the patients. However, the biggest compendium in Greece was written by Galen. He came across in 131 Christian era, and he wrote. He was to write one of the most exhaustive books in Greek language about medicine. And the Muslims translated this, and they called him the Jalinus, and this perpetuated during the Islamic times. So now we come to the Islamic period, which started in about 700 Christian era, 1500, and lasted up to 1500. During this time, the Europe was completely in the Dark Ages. They practiced voodoo medicine. The superstition prevailed, and people used to be, even the lepers used to be burnt, because they used to be afraid that the lepers would spread their disease. But this was the period when the Muslims were rising, the Islamic civilization was developing and rapidly expanding. Medicine as practiced in the Islamic lands was the only rational medicine that was being practiced. And actually, Europeans used to travel to the Islamic lands to learn medicine. And if you were a patient and you wanted the best possible treatment, you went to one of the Islamic hospitals. So we're going to talk about a little bit about that. During the early Islamic period, all the Greek and other texts were translated into Arabic. A big translation movement occurred, and we are going to talk about it a little bit more. Not only that, but because Arabic did not have medical terms, there was a dictionary created, a lexicon or a dictionary, which translated the medical terms from Greek into Arabic. And all this was systematically researched out, and there were books and encyclopedias that were published, which we are going to discuss further in our presentation. So one of the biggest developments that took place was the foundation of what was called the House of Wisdom, which was called Beit al-Hikmah. It was founded in 214 of Hijrah, or 830 of the Christian era, by Khalifa al-Mamun, who was an Abbasid Khalifa. And the rationale was that Khalifa Mamun saw Aristotle in his dreams, and Aristotle told him that there was no reason that rationality was conflicting with religion, that they could both go along together, and that could be the basis and fundamentals of the sciences, including mathematics, algebra, trigonometry, geometry, astronomy, and medicine, of course. So the Khalifa became very interested in knowledge, and he started sending ambassadors to various parts of the world, especially the parts that were known or close to the Islamic Empire, was the Byzantium, the Greek islands, the Sassanid Empire or the Persian empires, the Indian Empire. So emissaries were sent to all these places, and they brought back books and written in their language, Greek or Pahlavi or Syriac or Indian. And the Khalifa got these translators to translate this into Arabic. So here is the illustration of Bayt al-Hikmah, which was done in 1237 of the Christian era. Here are the scholars. There's a teacher sitting in the first, and a student is reading the book, and the other students are listening carefully. And this is how the knowledge was spread to the common people. This was in Baghdad, of course, because Baghdad was the place where the Bayt al-Hikmah was. So here is an illustration of Khalifa Ma'mun sending an ambassador to Byzantium Emperor Theophilus to obtain books and manuscripts. In fact, there were, skirmishes or little wars between the Byzantium Empire and the Islamic Empire. And the Khalifas used to run this wars. And if when the Byzantiums got defeated as a part of the peace treaty, it was that they would give them the books which they possessed. The Byzantium did not recognize that these books were so important. So all the Greek books were sent to the Islamic Khalifa, and they translated them to their benefit. So here's this. Later on, the Ottomans developed colleges and schools and medical schools on the illustration of like Bayt al-Hikmah or the House of Wisdom. Here's a school which I showed you, and here's a observatory where astronomy was taught. Astronomy was very important to the Islamic scientists because we wanted to know the exact timing of the prayers, and we also needed the direction of the Qibla. So the direction was very important. So, and then they traveled a lot, so geography was very important. One of the first and important things that occurred in the Islamic civilization was the development of the hospitals. In fact, no hospitals existed before the Islamic times. And there was a school and hospital in the Sassanid Empire called the Jundishapur School of Hospital. This was overrun by the Muslims and taken over, but then the Muslims, this was being run by the Christians. So unlike the other warriors like the Mongols who destroyed everything that they conquered, the Muslims did not destroy the hospital and the medical school. In fact, they approached the chief physician, whose name was Bukhtashu, and told him that, look, you can continue, but you will be under Muslim patronage now. You'll be paid by the Muslims and by the Khalifa. You continue to treat your patients and develop the school. So it so happened that the Khalifa himself, the successor of Harun al-Rashid, fell sick, and he had to send for the Bukhtashu to come to Baghdad to treat him. Then he found that he treated him very successfully, and he found him to be very intelligent. So he asked Jurjis Bukhtashu to form a hospital in Baghdad. And this was the first hospital. It was called the Abidi Hospital. We'll talk about it. But some very big hospitals developed in the Islamic country. One of the big hospitals was called the Mansouri Hospital. This was founded in Cairo. And here is a vast document of the Mansouri Hospital. It says, the hospital shall keep all patients, men and women, they have to, until they're completely recovered. All costs are to be borne by the hospital, whether the people come from near or far, whether they are residents or foreigners, strong or weak, low or high, rich or poor, employed or unemployed. So here, look at the document. The document says that everybody has to be treated, irrespective of their status in society. There were no condition or consideration of payment. They didn't have to pay a single dime to be treated in the hospital. The entire service is through the magnificence of Allah subhanahu wa ta'ala. This is the translation that I have done over here. And then to support these hospitals, pharmacies developed. There were no pharmacies before the Islamic times. The Muslims were the first to create pharmacies. All the drugs were labeled. The pharmacists used to dispense. Look at the scales. They would dispense exactly according to the scales and according to the prescription of the doctor or the physician. And then this was given to this never occurred before Islamic times. This occurred, and the development of pharmacies is an Islamic invention. Now we'll go to some of the physicians. The early physicians in Islamic times were usually Christians, because they were the people that they had the Greek knowledge. They could translate the Greek medical books, and therefore they were the practicing physicians. One of the early ones was Husain ibn Ishaq al-Abadi. He was also a translator. He translated a lot of books from Syriac and Greek into Arabic. He was able to coin some terms, medical terms, and he practiced from the 3rd century onwards. So Husain ibn Ishaq was a student of Ibn Saviya. He became a great translator. He was the chairman of the House of Wisdom, and he did a lot of translation, which became standard books of reference for the Muslim physicians later on. One of the early physicians in the Muslim Empire was Ali ibn Rabban al-Tabbari. He was in the Christian era of 838 to 870. He was a psychologist. He was either originally Jewish or Zoroastrian, but he embraced Islam under the Khalifa of Mutassim. He became a physician to the court, and he wrote an encyclopedia of one of the first encyclopedias in medicine called the Firdaus al-Hikmah. This was written in 7 volumes. He had identified that the children's diseases were separate. They were separately afflicted, and therefore he formed this separate section in his Firdaus al-Hikmah for pediatrics, and he was the founder of pediatricians. So Tabari he wrote the first systematic book, as we saw. It was translated into Latin later on and used as a textbook. This was called the Paradise of Wisdom, and it was a compendium and information of medical knowledge. And he had his sources from the Greek, Persian, Indian even, and he also had a chapter on textbook of anatomy. Then we come to one of the most important physicians of Islamic times. His name is Muhammad ibn Zakaria al-Razi. He was born in 251 of Hijrah. That is the equivalent of 865 of the Christian era. He died in 925 of the Christian era, but he was the most astute clinical physician. He diagnosed diseases. He identified so many diseases. He identified allergy. He identified between smallpox and measles. He wrote a compendium, which was then translated and used as a standard textbook of infectious disease by the Europeans. So he had a long-lasting effect on the Islamic civilization. In fact, he's recognized as one of the most worthiest contributors to medicine. He was born in Rain near Tehran. We visited his birthplace when I traveled to Iran. And he was later transferred to Baghdad and became the chief physician to one of the well-known hospitals. The Khalifa told him, I want you to build the best hospital in Baghdad. So the way he set about doing this is he took pieces of meat and he hung them in the various parts of the city. And then he sent people to look how the meat rotted. And then he selected the place where the meat had not rotted at all in like over a month. So he knew that this place had the best environment, the best atmosphere around. So although microscope had not been invented, the theory of microbes had not been put forward by Pasteur, but he, in his mind, knew that there was something in the environment that could cause infection to occur. And therefore, he selected the place which had the best or the lowest infection rate. So look at the wisdom. He is recognized as the best clinician of Islamic times, and his portrait exists in the Princeton Chapel. In the Princeton Chapel, if you go there, the history of civilization is written, and Al-Razi is noted for his clinical acumen. So the works of Razi, his book Al-Hawi, which he wrote, became a standard textbook of medicine for the Western universities for almost 2 or 3 centuries. In fact, a copy of it is preserved in the National Library of Medicine. I went to the National Library of Medicine and took this picture of his book. One of the original copies of Al-Hawi, which is maintained in the National Library of Medicine. So here's a page from that book. It's called the, he had it called the Mansour, after the Khalifa Mansour, that he dedicated this book to. And the other physician that wrote a very authoritative book is known as Al-Majusi. He was known as Heli Abbas when he got translated into Latin. He wrote the Kitab al-Malaki, the Royal book, and it up here it gives you the each of these chapters dealt with all the various diseases. They were tabulated very systematically, and therefore the British author Emil Shavar-Smith, who is a professor of history of Islamic medicine in Oxford, says that during the Islamic times, the people were so systematic that their books became the standard textbook on which the Western scholars learned their medicine. So here's a copy of the Kitab Kamil al-Sana al-Tibbi al-Maruf al-Kitab al-Malaki in the National Library of Medicine. Again, these people were phenomenal. They were absolute marvel of their times. One of the most important ones, of course, in Islamic medical history was Az-Zahrawi. He was the surgeon who wrote a book about surgery, which became the standard textbook of surgery for 400 years. It was known as Al-Tasrif. He wrote about all parts of medicine up to his time, but there was one part that was devoted to surgery alone. This was very unique, and the first time in the history of civilization that he illustrated his book with surgical instruments, and therefore he should be rightfully called the father of modern surgery. Here are the illustration of his instruments. He described many new instruments. One of the most important ones that he described was the forceps for delivery of fetuses. Of course, at that time, they would deliver dead fetuses, and he would use this to extract the fetus, because otherwise the mother would die. If the baby died and the baby was not born, the mother would also die. He described various other instruments like surgical saws, surgical cups, surgical pentals, syringes. He also described the first time the catgut that is being still used today as an absorbable suture, even in the modern times. And here is some of the illustrations in the Ottomans. The Ottomans illustrated his works and described how these surgeries were performed: tonsillectomy, hemorrhoidectomy, which are done like what they are being done today. So here is a first translation of Az-Zahrawi's book in English. It was in 1973 that this book was published, and this book was the one that I read and became familiar with the contribution of the Muslim physicians. Of course, the most important physician of the Islamic times was Ibn Sina, who was called Avicenna. He was born in 370 after Hijrah, or the 980 of the Christian era. He lived only for about 50 or 60 years, but he produced some of the biggest and the most important medical volume. His book, known as Qanun fil Tib, became the standard textbook in the entire Islamic history, and then it was translated into all European languages and was used by the early Europeans as their standard textbook of medicine. If you had to become a doctor, you had to know Qanun fil Tib. Here's an illustration of Qanun fil Tib translated into Persian. And the canon of medicine was translated by Gerard of Cremora. He became the standard textbook, and you see copies of it lying around everywhere. The last physician that I'm going to discuss today is Ibn Nafis. He was the discoverer of the pulmonary and coronary circulation. He discovered the circulation much before William Harvey, who wrote about the circulation much later, 400 years ago. So we are coming to an end of our presentation here. Very quickly, this is how Ibn Nafis described the pulmonary circulation. This is his book, the monograph that he wrote, which, so what was achieved during the Islamic times? All the ancient medical literature was translated into Arabic. This included the Greek, the Syriac, the Pahlavi, the Byzantine, and the Indian. There was the development of the hospitals, as I said, development of the pharmacies, a system of medical education developed, which I didn't get to elaborate too much on, but the system that exists today, like the interns, residents, fellows, professors, that all developed during the Islamic times. There was research done into the efficacy of medicines. The medical licensing was established. Medical malpractice was established. Ethical standards were set. There was the creation of medical texts, which I showed you already. And there was dissemination of medical knowledge, increase of health and hygiene. What was passed on? These books became translated and were used by Europeans. The hospital system was adapted by the Westerners. The pharmacies were then elaborated upon. The laboratory technicians, etc., was developed, and research, how to do research, was developed and passed on to the Muslims. So these are the legacies of which the Islamic civilization should be proud of, and which became the hallmarks of Renaissance of Europe, and which led the third phase of Islamic. So conclusion, the logical medicine was started by the Greek. At the end of the Greek, the Muslims took the torch of medicine. They not only translated all the extant medical literature from Greek and Sanskrit and Syriac and even Chinese into the Arabic language, but they passed it on. They didn't keep it for themselves. They passed it on to the Europeans. And because of the documentation, because of the knowledge that the Muslims had during the Islamic civilization, medicine has come to the status which it is now. So the Muslims have to be really proud of their heritage. And unfortunately, many Muslims don't know. But that's what the NIMS wants to do. It wants to propagate, it wants to disseminate the knowledge that occurred during the Islamic times. That's why the NIMS has been created. You can go to www.nims.org. We have the IMANA published the journals before. We have a museum and a library now in Meadows, which is a suburb of Chicago, Illinois. Here's our office. Here's our presentation. We thank you very much for being. And we can now take question and answers in the question and answer session. Thank you very much. Assalamu alaikum.
Thank you so much, Dr. Nagamia. That was obviously very informative. I know some people that have been commenting have been saying the same thing. So thank you so much for going into so much detail about that. We actually had a question. So just real quick, if anybody has any questions, feel free to put it in the comments, and then inshallah I'll be able to ask them. But we actually had a question that was asking who really discovered how the heart works. And alhamdulillah, you already addressed that with Ibn Nafis. If there's anything else extra you want to add to that part or to clarify or anything?
Well, I think Ibn Nafis was the first one that actually described a lot of, he did a commentary on the Galen's anatomy. And so it was very customary for the Islamic physicians to go into the text and then add their own commentary. And he described the Galen's anatomy, and then he commented that Galen, what he wrote was wrong, and that this is my finding, that the blood actually circulates through the lungs and then returns back to the heart. And when it returns to the heart, it's enriched by what was known as the spirit, the lively spirit. They didn't know oxygen at the time, but they knew that it got enriched. And then this enrichment was needed by the rest of the body. So look at without it, when you have to see that at that time, what was developed and what these people knew and how they could infer by logic, and logical thinking was very important.
Yeah, no, alhamdulillah. Could you also just, we don't have a specific question about this, but even just with you and I talking previously, just touch upon how, how such a wide berth there was of the Muslim world, and how a lot of the people that we know and commemorate today weren't just Middle Eastern or weren't just, one specific culture, but they were from a bunch of different cultures.
Oh, yeah. In fact, as I told you before, that the early physicians in the Islamic were all Christians. For example, the Husain ibn Ishaq, the Bukhtishu family actually, they have 300 years of passing from father to son. And they practiced in the Islamic lands under the Islamic patronage. And in fact, they became so rich that, it's very interesting to go into the depth and the detail that, one of the Bukhtishus, his home at that time was air conditioned. It was air conditioned by ice that was brought from the mountains to his house, and it was put in the walls, between the two walls, so that the house could be cooled down. So can you imagine what kind of luxury they live? They say that the salary of one of the book issues was 4 million dirhams, which is the gold coins. Now, that's almost like $1 billion in present money. So that's how rich the doctors were at the time. And these were Christian doctors working under the Muslim patronage. Then, of course, there was the Jewish doctors as well. For instance, Maimonides, he was born in Spain. He worked under the Muslim rule in Spain. Then he emigrated to North Africa. Then he ultimately came to Egypt. And then he joined the personal physicians of Saladin, the Muslim commander. He was a person. He was Jewish. He wrote his Jewish thesis. He wrote so many of his books in Hebrew, but the medical and scientific books that he wrote were in Arabic. So under the patronage of Muslims, there were a lot of other faiths that people practice, and they were allowed to freely practice their faith. I mean, being a court physician and being a military commander, he was allowed to practice his own faith.
Yeah, no, I mean, it's just incredible. And I think, just personally for me, going through med school and going through residency, I didn't know a lot about this stuff until, I learned about it after speaking with you and, working on these different projects. So it's definitely, like you said, definitely a lot more work to do and, to help enlighten a lot more future Muslim physicians and physicians everywhere, inshallah.
Any more questions?
I don't believe so, but we are at the hour mark too. So alhamdulillah, we got it all within that time frame. So thank you so much again, Dr. Nagamia, for the talk. And thank you to everyone who listened in. As Dr. Nagamia mentioned, we're going to have many more webinars and many more talks. So please subscribe to the YouTube channel. Please like our Facebook page. And Dr. Nagamia mentioned the website, www.nims.org. And inshallah, we'll stay updated with that as well too, as for any future events. So thank you so much.
You want to, Mariam, you want to tell them about the women's seminar that we're going to have about women in medicine?
Yeah, absolutely. Yeah. So inshallah, in November, we will be having an event of highlighting stories about historical Muslim women in medicine history, and then also hearing from current Muslim physicians as well. There have been a lot, alhamdulillah, there's a lot of information about the Muslim physicians that contributed to medicine and science currently. But we also wanted to highlight the women's contributions too, and how there were a lot of women involved. We just don't know, again, a lot about them, and that there's a lot more work to do to translate documents and learn more about what everyone did in the history of Islam. So inshallah, that will be in November 14th, I believe, but please be on the lookout for that.
Well, I need to make people aware of another forthcoming presentation by Dr. Mubin Syed, and this presentation is going to highlight the current Muslim contributors to the science of medicine. Unfortunately, we don't hear about these people. These are people who have made such humongous contribution to the development of medicine that it has brought the modern medicine forward. But we don't hear of them. Unfortunately, they are not in the press as much. But Dr. Mubin Syed is going to bring you to the forefront. He's going to tell you about the discoveries that these people, and this is current, I'm talking about now, contemporary. So these contemporary Muslims who have contributed to the development of medical sciences, we should be proud of them. We should know about them. But we don't know. Unfortunately, we don't know. That's because we don't seem to talk to each other. We need to talk to each other more. We need to learn about each other more. And NIMS is the platform that we have established for this very purpose. So again, thank you very much. I think they're going to call this to a close. Thank you for being a very, very patient and a wonderful audience. Tune in, give us a thumbs up so that we know that you like the program. If you didn't like it, you can give us a thumbs down, but that's up to you. Very good. So, Alia, can we discontinue the program?
Thank you, everyone.